And joining us now live is the Director General of Health, Dr. Ashley Bloomfield, for some questions. Dr. Bloomfield, welcome to the program. Can you tell us about any new cases overnight?
Well, I'm fully expecting there will be new cases to report from overnight, but our cut-off time is 9 o'clock in the morning. Most of them are uploaded into the system between about 8 and 9. So by 9 o'clock we do the cut-off. Any new cases that have come in overnight, we will then report at 1 o'clock.
So at this point, you're not aware of any new cases to report?
Look, there will be information that has come through overnight on new cases, whole genome sequencing, and of course the wastewater results. We'll pull all that together at around 9 o'clock and then we discuss it through the morning, what it's telling us about the source investigation, what's happening with the outbreak, and then the announcements at 1 o'clock. What did of course come out last night was we talked about those 3 new cases that had been identified, bringing the total to 10. One of those, as you were mentioning, is an Air New Zealand crew member. That person was identified at routine surveillance testing. At this stage, we don't think that's related to the outbreak in Auckland. It may be a coincidental finding, but we will know more about that through the day as well. This
is the Air New Zealand case you're talking about?
Yes, indeed.
Right, so that's not the same as the 60-year-old with a link to the border from the current cluster. It's a separate thing.
Yes, it is that case. So it's a person, a woman in her 60s who is an Air New Zealand cabin crew member. Right. So there is a link to the border because they are an airline crew member.
But no link to the other cases?
Not at this point. And again, it was identified through routine surveillance testing. Because this person flies international routes, they have weekly testing.
So how big is the cluster? 10 plus the Air New Zealand woman?
That's right. It's 9 plus the Air New Zealand crew person, and so we're a total of 10 cases.
All right. Now, I know you want to wait until 1 o'clock, Dr. Bloomfield, but I'm getting the sense that you are aware of reports of new cases that you are yet to have a proper look at. Can you give us an indication? Because people, I think, are quite on edge at the moment, and they are wanting all of the information as soon as we can have it. Are you aware of any potential cases at the moment?
So what I'm going to say is 2 things. First of all, the pattern we are always in, and we did this last time and it works, is we want to have all the information. It comes through at 9 o'clock. Any results that come through late at night, the people may themselves not even have been told. So that's why we wait until the 9 o'clock cut-off. What I would say, though, is we saw in New South Wales that around 70% of the cases in their ongoing outbreak are close household contacts. So that seems to a particular feature of Delta, that there's high infection rates in households. And many of the people we were testing through yesterday were household contacts. So my strong expectation is that we will get more cases and we'll be reporting those today. The important thing is also that all our cases so far, all 9 that are associated with the outbreak, are in Auckland. And so we'll be looking to check and make sure that there are no cases from right around the country and making sure that there is good testing happening right around the country.
Okay, given what you know now, and given that we're now hearing the first exposure event was some 2 weeks ago, and given the information you've heard overnight that we're not aware of, how worried are you about this outbreak?
Well, just on the exposure event, there's one that's on our website that's from the 3rd of August. I don't know the detail there, but I suspect that is one of our cases that has been identified and tested positive just now was reporting symptoms that maybe go back quite some time. And so the public health team has been precautionary in putting that location of interest, adding that into the mix. But we do know that our wastewater testing results from across Auckland last week, right up until Wednesday, were all negative. And we will have the latest wastewater testing results today, not just from Auckland, but from a range of sites around the country as well. So that will help us build the picture.
Okay, so what date are you working on then? What's your estimate at the moment of when Delta was first in the community?
Look, it could be sometime up to 2 weeks ago, but our first case, of course, we only found this week, and the earliest that people who have tested positive were symptomatic was around around late last week or around the 11th and 12th of August. We could go back a couple of days that they were infectious. So there's nothing yet to suggest that it goes back any further than, say, the middle of last week. But of course, the whole genome sequencing of both these overseas cases, of our border-related cases, and doing those matches with the whole genome sequences in New South Wales will help us build the picture about where the source could be. And we will have more information on that today at 1 o'clock as well.
What's your latest advice you've had on estimated case numbers, how big this cluster could grow to?
Well, yesterday we talked about the modelling that Sean Hendy and his team has done, and the modelling, I think there are some other teams that have done a quick modelling exercise as well. What was the result? Is that there could be between... Yeah, they suggested between 50 and 120 cases that could be out there at the time you identify the first case. So far, we've found 9, and that suggests that we did find cases early on in this outbreak, which is good. But we expect, and people should expect, there will be more cases. That's why it's been very important that we've gone into the Alert Level 4 lockdown situation, and it's very important that people stay in their bubble. And if they've been a location of interest, they get tested.
Absolutely. Given what we don't know, though, and there is a lot we don't know, and we know that we had low rates of scanning into cafes and things, we know that this is a largely unvaccinated population of young people, you are going to have to extend those lockdowns.
Well, again, we'll be looking at all the information
What's
today
your current
and working
assessment
up some
of
advice.
it, Dr. Bloomfield? Because I think there are a whole bunch of people out there who are really wanting to know whether this is realistic to come out of a lockdown for the South Island on Friday, is it, and mid next week for the North Island. Is your current assessment that we will have to extend them?
Well, let's see what the results show today. All those results I've talked about. We'll prepare advice this afternoon. Cabinet is meeting tomorrow to consider it. Just a reminder, though, when the Prime Minister did make the announcement, it was essentially, she said, it's for at least 3 days right around the country and at least 7 in Auckland and Coromandel. As a starting point, you'll recall in the past we've gone for 3-day movements up the alert level as the first thing to do. And that just helps us gather information. There will be announcements about that tomorrow after Cabinet's considered advice and taken decisions.
Do you know what percentage of contacts we are managing to trace with a rolling average of 48 hours? Remember, the gold standard was 80%. Do you know what that is at the moment?
Well, we're just over 24 hours into the outbreak, so we don't have any of those data yet, but we will have them. We will start to be able to produce those through the latter part of today when we're 48 hours in.
Have you had any advice or any information that leads you to be worried about our ability to contact trace right now?
I don't have any concerns about our contact tracing ability. What I would say is, as you can see, and this reflects the demographic of our cases, there is a large number of locations of interest. We need everybody to keep an eye on those. The very important thing is anyone who is an essential worker and could be out and about, if they have been at one of those locations of interest, they need to not go out and about. They need to stay at home and get tested. With the rest of the population in an Alert Level 4 bubble type situation, that is extremely important cover really for our contact tracing efforts.
What's your advice, Dr. Bloomfield, to people who, young people in particular, who now want to be vaccinated because it's a younger population that seems to be affected in Auckland? I know a lot of my friends who are in the 20s and 30s are saying, I want to rock up to a vaccine centre and get a jab. What do you say to those people?
Well, we're just restarting the vaccination programs right around the country today. Every DHB had a plan in place to vaccinate in Alert Level 4 safely. Just yesterday, the lower age limit was reduced down to 40, so people 40 and over can now book. And then it drops back down again very quickly. And from 1 September, first day of spring, anyone will be able to book and have their jab. So I would encourage anyone in any age group that's eligible, as soon as you're eligible, to book and get the vaccination.